Obviously, in Indiana, we have a large National Guard presence, and you touched upon it briefly, but I was wondering if you could detail, in terms of our National Guard, the impact that sequestration will have as we move forward.
Senator Donnelly, the major impact in the near term of sequestration will be the reduction in our maintenance, and our maintenance readiness will decline drastically, which will require us to park vehicles. As General Odierno has mentioned, we're so closely tied in the Army side with the contracts that they have in their depot maintenance, and a lot of our equipment returning from overseas, there's already a backlog. In addition to that, then, if we furlough or if we have a hiring freeze, we'll go ahead and we'll reduce the amount of maintainers at the Armory level in hometown America, which further degrades our ability just through annual services, nothing else. And with that, that time to respond to the disaster in your home states begins to increase. We had 2,500 Guardsmen from 4 states this past weekend that responded. We'll be able to continue to do the smaller ones. I'm very concerned about the more regional, long disasters, the catastrophic and complex catastrophes.
Okay. Thank you very much. And Mrs. Secretary, this is for you or General Dempsey. Okay. Just want to ask real quick, in terms of suicide prevention programs, we lost, as I mentioned last week, more young men and women to suicide in the past year than we lost in Afghanistan. And I was wondering the effect of sequestration on those programs, the mental health programs.
Well, I mean, sequestration has an impact on everything.
Right.
I mean, we have invested a lot of money and effort and time in trying to build resiliency and try to get after the issues we have with suicide and many other issues. We have counselors that we've increased significantly in every one of our installations that help our families and our soldiers to work through coping mechanisms and problems that they have. But that will all be affected. We will not be able to afford the numbers of counselors that we have today. That's just simple. It's just we cannot do it. That is one of our high priorities, so we'll try to sustain it at the highest level possible as we go forward. But it will have to take a reduction. And this is serious business, you know. Although the effort we've put into it, we have not yet put a dent into our suicide problem. And so this is of deep concern to all of us as we move forward. It also will impact our other critical family programs that have helped us over the many years as our families have sacrificed so much over the last 10, 12 years. Those will have to be reduced as well. And so we're looking at this very carefully to define where the critical ones are and where the ones that are still important and not as critical. But in every case, we'll have to reduce the size of all these programs.
Thank you all for your service.